look like that it causes?
Well, lupus is a autoimmune disease. There are certain disorders where the immune system, which is normally only supposed to attack those organisms and things that are not the body,
Okay.
kind of gets misdirected and can affect portions of your body itself.
And we're seeing some pictures up there right now of that rash.
That's right, that's right. So what happens is, in many of these autoimmune diseases, and lupus is one of them, various parts of the body can get affected. And one of the most, these are fairly commonly affecting the joints and cause arthritis. Now, lupus itself is called lupus because lupus stands for wolf, because people get this malar rash, which is a rash across the upper part of the face, which you see here, that's thought to look wolf-like.
Yeah. Is this something that can happen to anyone out there?
It can. It certainly can. It can happen to anyone. It has, of course, various factors, genetic and environmental. And if it's common in your family, then it's likely or possible that you may get it. And if you have nobody in your family, although it's less likely, you still can potentially develop lupus in your lifetime.
Is it contagious?
It's absolutely not contagious. In fact, it's one of these things that you either have in your genes or you don't. So being around people who have lupus will not make it more likely that you yourself can get lupus.
Is this treated by medication, or how does that work?
Certainly it can be managed by medications and other techniques that can limit the severity of the events that can affect your body with it. And the various medications all have the basic underlying principle of modifying your immune system. Since this is a problem caused by your own immune system, what these medications try to do is either suppress the immune system as a whole or suppress that portion of the immune system that attack the joints or your kidneys or certain other organs in your body. And of course these tailor-made immune system modifications are newer, and as time goes on we can expect to see better and better medications, and maybe one day a genetic treatment that'll kind of knock it out completely.
Is this something preventable, or is this something I can prevent?
It's not preventable.
Okay.
If you're going to get lupus, or if you have the chance of getting lupus, you most likely will get it, but it's definitely manageable with medications such that you can live a productive life.
All right. Well, thank you very much for joining us this morning, Dr. Vijay. And remember, Dr. Vijay is here Sunday to answer all of your medical questions. So if you have a topic you would like us to